keeps the artery strong, and if they're already having an aneurysm, it can keep it from getting worse, and it can even repair it without surgery because we rebuild that collagen over time. This isn't to recommend using vitamin C to treat an aortic aneurysm if you've been diagnosed with one, because it can blow up and be very severe, and I recommend listening to your surgeon on that. But this is about the health of your blood vessels. In another study that was in Medical Hypothesis this year in 2016, titled Arterial Tortuosity Syndrome Reveals the Function of Dihydroascorbic Acid in Collagen and Elastin Synthesis, Implications for Skin Care. So, ATS, or arterial tortuosity syndrome, is when an artery gets kind of weak and doesn't maintain its integrity and twists all up. It gets tortuous or twisty. And when it does that, the blood can't travel straight and fast, and it bounces around, and it can form blood clots and things like that, which can cause strokes. They parallel the arterial tortuosity syndrome with scurvy, because scurvy, again, as we already talked about, makes collagen, which keeps blood vessels strong. They then talk about how putting vitamin C on the skin helps produce collagen in the skin, in the dermis, and that it's been shown that vitamin C will go into the skin. A study that was in Indian Pediatrics in 2005 called Absorption of Oil in Preterm Babies, a pilot study, they found that they could prove that if you put coconut oil on the skin, the coconut oil is absorbed into the skin. Some oils are, some oils aren't. Some oils, like some of the oils, can actually be carcinogenic. Coconut oil is very good for the skin. And you can mix vitamin C in the coconut oil, put it on the skin. The skin will absorb the vitamin C. It will help repair sun damage, as we'll talk about in a minute, but it will stimulate collagen production in the skin to help the skin be plump and youthful and wrinkle-free. The type of vitamin C I recommend is called ascorbyl palmitate, and I'll show you the ascorbyl palmitate I use in a minute. But for skin health, I want you to think about putting it in coconut oil and applying it to the skin. In a study that was in the Journal of the American Academy of Dermatology in 2012, they showed that how free radicals contribute to aging and disease, and that topically putting antioxidant on the skin will neutralize those free radicals. And they're talking primarily about vitamin C. So again, applying vitamin C to the skin neutralizes the free radicals that's associated with aging, especially from the sun, photoaging from UVB, ultraviolet B light. There's UVA and UVB, and I was taught that B is the really bad one. That's why it has a B. Little things that help people like me graduate medical school. In another study that was published, called The Differential Effects of Topical Vitamin E and C on the Treatment of Ultraviolet Light-Induced Tumor Development. And so they took these mice, they exposed them for 10 weeks to high doses of ultraviolet B light, and then they applied topical vitamins for 15 weeks. And they found that vitamin C helped repair the damage and help them. They found that vitamin E on its own might accelerate the growth of tumors in the skin, especially in their female mice. So they recommended that if vitamin E is being used on the skin, that it should be mixed with vitamin C, but I myself would just go with the vitamin C because so far it's been shown to be very beneficial. So the oils are absorbed. You can make a topical cream with coconut oil and vitamin C and do yourself a lot of good. There was a study also in the Medical Science Monitor in 2003 called Reducing the Need for Arthroplasty, Benefits for Patients and Budgets. And what they found is that the American diet is very high in lysine. And again, lysine makes procollagen, and procollagen becomes collagen. And vitamin C hydroxylates the lysine into procollagen. But they found that Americans were often low in vitamin C. So they found that by supplementing some vitamin C in their diet, they were able to convert more lysine and amino acids into collagen. And their findings showed that This dietary change can be expected to restore hip cartilage in 1 year and prevent surgeries. So what they found was people who've been told, man, your hip's really biffed up and you need hip surgery, they found that by giving them the vitamin C, the cartilage will start to grow, and over the course of about a year, it can repair enough to where they don't need the surgery. And this is taken by mouth. Stronger blood vessels, stronger skin, stronger joints. So, taking a little more vitamin C, applying topical vitamin C to the skin, and I think ascorbyl palmitate, which is a fat-soluble vitamin, is one of the best ones. I want to give you some general food recommendations. Beans, pretty much all beans. Broad beans, butter beans, kidney beans, things like that. They help your body produce hyaluronic acid. Hyaluronic acid is another product they inject into wrinkles and things that sucks water into it and plumps the skin up. Eating the beans